prostate cancer.
Prostate cancer.
Prostate cancer. I guess when people hear it, they hear the death word after it.
I have been diagnosed with prostate cancer.
Are you having any pain, Bill? Surgery's done.
I'm a cancer survivor.
I promise to be true to you.
In good times and in bad.
In good times and in bad.
In sickness and in health.
In sickness and in health.
When I walked in the door from doing a few errands, he put the phone down. I thought it was for me.
And of course, she's only hearing half the conversation.
I said, "Is the phone for me?" And he said, "No." He goes, "I have prostate cancer." Just blurted it right out. And we were both like, "You have what?"
Coping with the news that a loved one has been diagnosed with cancer can be an emotional and stressful time, not only for the person diagnosed, but also for his or her family.
And we here at ABC12 recently experienced that emotion when a member of our own family, my anchor desk partner Bill, was diagnosed with prostate cancer.
With the hope that my experience and my family's could be turned into something positive, we documented my journey.
It could be any man's journey. It's also the journey of Bill, his wife, son, and daughter.
I have been diagnosed with prostate cancer.
Prostate cancer.
Prostate cancer.
I guess when people hear it, they hear the death word after it.
Once you hear that word, it's basically, in the minds of many for a moment, it's all over. It's a death sentence.
We just both stared at each other and I thought, oh my God, oh my God, oh my God. It's that C word. Once you hear that C word, it's like.
When I first heard the C word on the telephone, it took me to a place that I've never been to before and really never want to go again. A place I can't describe.
So work out fine.
I know. Get it over with.
And you have to figure that I had to have been thinking about it. This is my second biopsy. Playing the mind games, what would happen if, when that phone rings. But when it did, all that was forgotten, and it was acceptance and shock.
I guess when people hear it, they hear the death word after it. You think that there's death when you hear the C word.
But is that true in all prostate cancer cases?
No, it's not a death sentence at all, and that's why we keep track of it. It's like any cancer, the earlier you diagnose it, the better.
The best way for men to be screened for cancer and to diagnose it are for men to get a PSA done, which is the prostate-specific antigen blood test, and also a rectal examination to examine the prostate gland.
Let's face it, no one likes the digital exam. No guys like that whatsoever. It's painless, and it takes all of 15 seconds. But that exam, combined with a PSA, can tell so much.
This here is Mr. Harris, patient Dr. Rotella.
Hello, sir. Good morning. My name's Pete. I'm one of the nurses at my house. Take care of you.
All right, man.
This is Rhonda.
I'm one of the nurses.
It is a medical challenge that, according to the experts, 186,000 men will battle this year. 28,000 of them will not be victorious. But the experts also say the number of men who die from prostate cancer each year can be lowered, not only through cutting-edge technology, but simply by using common sense.
The buck basically begins with the family care physician, you in particular in my case. Right. Can you underscore the importance of, of your role in this?
Well, you're right. It is where it started. You and I have been together for, I was checking, it's been 20 years now. And we're the ones who initiate, in this case, the PSA test, which, as you know, over the years has had a fair amount of controversy as to how often to do it and how accurate is it. But fortunately with you, we've been checking it over the years, and that's, of course, how we diagnosed it.
And it was the PSA level 2 years ago that was elevated. It was kind of a clue, and we just kept an eye on it.
And in my particular case, the PSA numbers spoke volumes.
Your PSA has been bouncing around from, I was just looking back, and around 2000 it was running perfectly normal. And it crept up to 4 and 5, and it would go back down. And then I think it was 05, you had a biopsy.
But with all the testing and treatments currently available and new ones constantly on the horizon, men, like myself, often risk the life-saving benefits of early detection because of one trait, one gene, one common male macho characteristic.
You guys are stubborn. I got 3 brothers, they won't go. Bill, I have to lose 10 pounds before I go to the doctor. I can't go. Let me get into the summertime when I'm running, then I'll go then. And then time just goes and goes, and he keeps putting it off. And then I'm thinking, now it's getting next to Christmas. I'm thinking, Bill, you really need to go see the doctor.
I'm sure she said she had a broomstick at the back of my head forcing me to go get a physical every year, like us guys should be getting.
With the treatment available these days, it's to not do it is just self-defeating, suicidal.
They are totally stubborn. They won't go to the doctor.
There's been a study out there that says men who have nagging wives live an average of 7 years longer than men who don't. So men, take your wife's advice.
I guess they have this thing that what you don't, or what I don't know can't hurt me. So if I don't know I don't have it, then okay, everything's fine. And then when I do get it, I'll deal with it. Well, it could be too late then.
Too late. That unfortunately will be the case of an estimated 28,000 American men this year.
But early detection in the form of a couple simple, painless tests could greatly reduce that number.
You've heard the phrase, physician, heal thyself.
Anytime you ever went to a meeting and you asked, a meeting of doctors, you asked who had a PSA, and almost every hand in the room would go up. So it's not perfect, but it's a great test.
Face up to it, get the tests. When they come back less than what you wanted them, get the work done.
In just a moment, the story of a Genesee County man who is cancer-free thanks to prostate cancer testing.
And in part because of his wife's intuition.
An adult male, 1 in 3, will have some prostate problems. 1 in 3? That's pretty common. Why aren't people talking about it? Why aren't people doing something about it?
In the complex equation that is cancer survival, the actual medical procedure, in my case, the surgical removal of the prostate, is really just one component.
Many health experts and cancer survivors point to numerous treatment options, along with several other factors which come into play in battling the disease.
I'll call those supplemental factors the 3 F's: faith, family, and friends.
When Bill did his little goodbye on the air, the phones have been nonstop.
Well, finally tonight I want to close on a personal note, letting you know that starting tonight I'm going to be away from the anchor desk for an extended period of time. Part of that time for some R&R, richly deserved I hope, and quiet time with my family, the rest to treat a medical problem. I have been diagnosed with prostate cancer. Emails
pouring in. Sitting in Florida, I don't know, he had 70, 125 each day. And I said, oh, you have to print these. I mean, they were wonderful emails.
In all cases, it's where the bond of the family and faith and friendship make it much stronger. I can't imagine having to go through this, nor my family going through this, without that bond we talked about, or our faith.
I want to tell you where our teaming up ABC12 is with the...
There was one friend in particular who shares that bond. ABC12 Special Projects Coordinator, videographer, and longtime friend Mark McGlashan was literally by Bill's side during the surgery.
You know, I'm shooting the surgery, and at one point there, the nurse leaned over and said something to me, and you know, she said, "Your friend's prostate is really big." He says, and I'm like, I looked out and you know, it's my friend laying there. That moment just hit me, and it was just like, I didn't know what to think. It was the first time I really got a little sentimental about the whole thing, where I was like, it is my friend there, and I hope everything's going to be okay.
Thoroughly appreciate the outpouring, but there's other guys and families who are going through this every day.
Families like Burton's Sally and Ron Lathrop, who were experiencing their own journey the same time as Bill. Like hundreds of other families, Sally and Ron reached out to Bill by email.
When I watched this evening and you and your wife were at McLaren out in the hallway, I began to cry. I realized that God gave me the strength that day of my husband's surgery that went far beyond my own capability. So when I watched...
Thanks, Bill, for taking the load off of those of us who follow with our families. We had ours removed April 14th, having been diagnosed January 30th.
For Ron, there is no I when he openly talks about his medical journey.
Yeah, cancer's a we thing, you know. One of you has it, and the other one has all the emotional stresses and everything without physically having it, but they might as well physically have it.
I knew for 2 years that he had cancer. I knew in my heart it was just something. As a woman, when something like this happens, you know in your heart.
Sally was right. Ron was told he had prostate cancer, and both their lives were about to undergo a drastic change.
Call her and tell her. And I was so far away that I couldn't actually hold her and tell her, so she could tell me how strong she was being at the time, but I knew better.
I thought I was so conditioned. He called me on the phone and I collapsed. What he didn't know was my knees gave out from under me.
Wasn't scared anywhere along the way. They're going to take care of it.
So yeah, I was frightened. But I also knew too that I would have the necessary strength to deal with whatever the Lord's decision was.
And as it turns out,
He's mine.
With the new case of prostate cancer being diagnosed every 2 minutes, the journey traveled by Ron and Sally and Bill and Jane is one that is shared daily by countless other families.
The severity of the cancer and the treatment options will vary from patient to patient, family to family. But there is at least one common denominator to all these cases: the emotional roller coaster ride.
Which usually begins with shock, disbelief, then acceptance.
The first step, I think, is realizing you got it, and you have to do something.
You have to weigh the options, and we went through the radiation consultation and the robotic consultation and the do-nothing consultation. Risks, like any surgery, risks and side effects for all. But it's a mental thing is what I'm perceiving. How can you, the patient, live with it?
And I was almost at the panic stage, like, oh, we got to have surgery tomorrow. We have to get it out right now.
Let's try 180 over 60.
I think you're a little nervous.
Yeah, you think?
But you're thinking, okay, you know, life has been great to us. And two of the greatest kids, and life's been good, but so you need these little bleeps every once in a while. And I thought, okay, this is a little bleep.
It was hard. It was very hard. You never want to see your parents go through something like that. And it's the same way parents never want to see their children go through something like that. But I think the four of us really came together and we were there for each other throughout the whole time. And I think that's what really helped, just being there.
It's like something Mom said too in an interview she did earlier. It's like, you know, you go through life like, oh, everything's great, and then you're like, why us? What happened to us? And you know, you go with the flow and you do with what you can.
I'm done.
That's it. My gosh, no tears or nothing.
Yeah, you did really good.
The volume of your prostate measured 72 grams. So that's pretty big. That's, you know, maybe 3 times normal size.
We were shocked only because 2 years ago it was negative, and all of a sudden now it's positive. And you're thinking, you know, in the 2 years, what really happened?
We are a strong family. God has said this is going to happen, and so be it.
When I woke up this morning, it was pretty bizarre. It's just like a ton of water. Boom! 2 hours from now, you're going to be on an operating room table. But for me, 7 o'clock, you know, I'll be pretty much out like a light. And leave the work up to the surgeons and the surgical team, to you, and the worrying to my wife. Huh.
How about you, Jane? Did you sleep at all last night?
No, you can't sleep. Tossed and turned, tossed and turned, tossed and turned. Then you start getting scared. Then you're thinking, please just let this get over with. Does anything need to go?
No, me.
Just you. All right, come on, patient.
Oh, that's right, we're going that way, aren't we?
We're going that way. All right, Mark, off to the hospital. Let's get this over with. And then you want to ask, why? Why us? Why?
Last time I was in the hospital for an overnighter when I was 8. So this is all new territory to me. So a little bit apprehensive. Ding, 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 ding.
Yeah, ready and waiting?
Following my little sign.
Yes, I'll let you carry on.
Morning, reservation for one?
Yes, do you have washer and wall and anything for your family?
Some booties for your feet.
Great.
Make sure you put the nose skin on the bottom, so if you get up, you don't slide around.
Gotcha.
My name's Sherry. I'm with the RM First Assist. I'm going to help Doctor do the procedure today. Okay. I come by to say hi, see how you're doing.
Doing well.
See if you have any questions. Sometimes people have little questions. I've heard you're all versed up on this.
Yeah, I've done a little research, but yep.
Yep. Usually the first question everybody asks is how long does it take? So it's about 3 hours. Yep. It takes us 3 hours for the actual procedure. It's going to seem like a lot longer for the family. Seems like 5 minutes for you. About 4 hours in the room, half hour before, getting you ready, getting you positioned and stuff. And then half hour getting you woke up, getting you back onto the bed, all that other good stuff.
Okay.
So,
now, how long is he in the recovery room before you go to his room?
about an hour. They're going to make sure he's still breathing well, pain's under control, no nausea, no vomiting, all that good stuff.
Should have started a stopwatch. Usually doesn't take long.
You fading already?
Are you? Well, all the best.
Thanks.
Yeah, positive thoughts, prayers.
Yeah, we missed you last night on the news.
Yeah. I had to watch another channel.
Oh, no.
Oh, my God. You didn't hear that.
The thing that does scare me is my father died of cancer when he was 59. I will be 59 next year.
We never really tell anybody they're cured from it. We can tell them everything looks great and we're really hoping they're cured, but you never really know. Good. Pull it back a little bit so I can see. Suction in there again. Good size. The volume of your prostate measured 72 grams. So that's pretty big. That's, you know, maybe 3 times normal size.
Thank you. Oh, bye-bye.
Are you having any pain, Bill? Your surgery's done.
I'll get some more pain for you. Okay.
Took a little longer than I was hoping, but he's got a pretty big prostate gland, so that will usually take a little longer.
Okay.
But he should do well. You know, the prostate came out real nicely.
There she is.
Yeah. I don't know how to do this.
Can you get that?
I was ready to do a trim race, but
How do you feel?
sore, but good.
Sore?
I feel good. Later on.
You might even be able to go walking a little bit later.
Really?
Yeah. If you're up to it.
I'll bring my running shoes.
Exactly. I'm just so glad it's over with. So glad.
I'm so glad.
I know you are.
Well, you know, the pathology report, you know, it's a little different from the biopsy. The grade of the cancer was a little bit higher than what was on the biopsy. There was a little bit of cancer that had gone to the margin of the prostate, okay?
Which means what? Is that the outside?
It's right on the edge, right on the edge. A lot of times that means nothing at all. I mean, obviously we would like to have it all in the prostate, and we'll have you get a PSA about a month from today. You know, and I'd still expect that to be 0.
Would the magical PSA number be 0? Would it be the news that Jane and I both hoped and prayed for?
Bill's PSA report card in just a moment.
realize that if you're a man, it's not if you're going to get prostate cancer, it's a matter if you live long enough to get prostate cancer.
Any advice to the guys?
Listen to her when she says, go in and get your annual physical, dear.
They need to do that. They have nothing to lose here, nothing.
Solid advice from Ron, Ron's wife Sally, and my own wife Jane, all of whom have traveled down the same path, taken the same journey.
With a sobering prediction that 28,000 American men will die from prostate cancer this year, early diagnosis is the key to battling and beating it.
On May 8th, ABC12 teamed up with the Great Lakes Cancer Institute in providing free prostate screening. Of the 206 men who were tested, a digital exam indicated 50 had an enlarged prostate, 24 were considered abnormally large.
And in that same group, 37 men had abnormal PSA results. You want to beat prostate cancer?
Get tested.
My wife just recently had a lumpectomy, and between that and your report, and I said, you know what, it's time to do something, Dennis, so you moved me.
For someone who just went through it, would you advise other guys?
Definitely. Definitely. This is the way to diagnose prostate cancer early, where you can have better chances for cure.
All right, so anyway, the PSA looks perfect.
What was the number?
0.1.
0.1.
That's as low as they measure it. They never tell us 0.
They don't go 0.000?
No,
Okay.
no, 0.1 is as low as the PSA goes, so that's what we're looking for every time is 0.1.
You made my day.
Yeah.
Thank you.
Yeah,
that is great
so that's
news.
all great. Everything looks good. It looks like everything's out of there.
I'm a cancer survivor.